So when we look at associateships that fail, why do they fail? One reason is the associate is not busy enough, right? There's not enough work for them to do. They can't earn a living. Now, everybody thinks the grass is greener on the other side, right? So we have that issue that we have to deal with continually. But nonetheless, that's one of the things. So we have to make sure that this person is busy. Make sense? Is 30 new patients going to keep 2 dentists busy? Okay? So we may not have a demand issue now, but you add a full-time doctor, you are, right? So now's the time to look at, first of all, making sure that we're doing everything to improve our retention, right? And then think about, as we have this transition, you only have 5 ops, right? So we're going to have some clever scheduling to have 2 docs, 2 hygienists in 5 ops, and you'll very, very quickly need another hygienist, right? So we got to figure out how we're going to do that, right? And have you thought about that? Yeah. Okay, and what's your plan?
I've been trying to come up with a plan.
Okay.
Obviously, right now we would have 2 days where we would be open 7 to 7. The 2 doctors would overlap for 2 hours, and then we would open up on Fridays, and then the associate would take Thursday, Friday. Dr. McCullough would scale back to Monday, Tuesday, Wednesday.
Okay. So one way to do it is to split, right? So we keep our Monday through Friday, and we split on multiple days to give both doctors time. But just on the schedule alone, what's going to be the challenging part of this? The crossover, yes. Yep, exactly, Amber. It's the crossover that's going to be tough. And so that's got to be scheduled very carefully because during that time there can be no same day because you're not going to have enough rooms. You're going to have to schedule longer procedures during that time on both doctors' schedule so that you're kind of just one room people. So you've got your endo, that would be a good time for endo. And anytime you say, okay, I'm only going to schedule this at this time, we have a capacity issue, right? So we're building in a workaround to a capacity issue. Does that make sense? The other way to go is instead of spreading it within the days, spread the number of days, right? So this is a three-day. So one of you works Monday, Tuesday, Wednesday. The other one works Thursday, Friday, Saturday, and the next week you switch. Okay? Works pretty slick. That way, doctor has the office to themselves the whole day, and we're adding a lot of patient-friendly hours. So that would be my preference. Easier to staff, right? Easier to manage. We're not having to change how we schedule stuff. That would be my preference. So think of the amount of time off you have. You know, for crying out loud, you're working 3 days a week, and you're going to have times when you've got, 4 days off in a row. Pretty nice. Means you have to work every other Saturday. So that is a challenge. And staffing, of course, is always a challenge. There's just I don't care what your schedule is, it's always a challenge.
I have one other question.
Yes.
We do have room to add on to our facility.
Yes.
At what point in the process of the associate do you make the decision it's time to add?
Do you have your contractor's number? Now. Nate? Now. Yeah, it is now.
Wow. Okay.
So from people in this room who've been here for a long time, who have seen how this all works, they all know it is now. How many ops can you add?
I've got a half acre, so we could add 30.
So you're adding 7. I'm not kidding. You're adding 7.
So you're saying 12 ops?
Yep.
Wow.
Yep. So 12 ops, a 3-doctor practice, right? So not all 12 ops are going to be full from day one, right? You're going to build it. You're going to plumb it, but you're not going to equip it. You're going to equip it as it needs to be. And once you get this rolling, it's fairly shocking to people how it fills in. And maybe we can have Dr. Lester give us a, because this was you are him.
It's easy to sit here and smile because we've been there. We were where Dr. Williams was at one point. 55 was exciting, and thinking 70 would die and go out into heaven, and now that's in the rearview mirror. And we started with 3, started with TTI, and quickly they said, oh, you're completely out of capacity. First meeting, so we went home and we bought a practice, or bought a location, and went to 6. And I thought, 6 is great. So the very next meeting, I came back and I was like, hey, this is awesome. And they said, okay, tell us how it's going with 6. And they said, you kind of have the same capacity problem. And so I literally, in my brand new building, I called home, and we knocked a hole in the brand new building and added 5 more out. And so the next meeting came down, and I couldn't add another, but so we have 11. So and then we came back and said, okay, we have 11, and they're like, okay, now you kind of have a demand issue because now we actually have the chairs. And there's a few ways to do this. And one, he was talking about these fold-ins. I was like, sweet, I don't know the guy. So I went and knocked on his door on Sunday, Saturday after I came to the meeting, and on Sunday night, I bought another practice. And we folded him in. And so it really works. How many docs practice in your town? 2 others in a town of 30,000?
How big is your town? 8,000.
So we're in a town of 10,000 with 9 docs, and you find a way to compete, right? So we're like 1,100, 1,200 is where we're at per doctor. So yeah, I mean, your other option would be a whole nother building across town, and a town of 8,000 though is a pretty small town. I would definitely add the ops, like get on the phone.
Yeah. And so just so you're doing 70, what's the operation doing now?
4.5 in the one office.
Okay.
And 1.2 in a new location in a town of 2,000.
So you went from 70 to
About
$400,000 a month.
Yeah.
Okay. So does that answer your question? And then simultaneously, right, we're working on demand. Even though we don't need it right this minute, you're going to need it. It's going to take you, 6 months or so to do the addition. And that's not for everybody, right? This is a small town, so zoning's not going to be difficult. It can take 6 months to a year in some places to get a building permit, but you won't have that issue. They'll be delighted that you're going to do this. Yeah, there you go. And you've got your population to dentist ratio is so favorable, right? And that's what these small kind of agricultural rural towns, not many dentists, lots of people, and these kind of cities, the dental streets are paved with gold. They really are. So, very good. Congratulations. This is going to be fun, watching this.